Classical Hodgkin lymphoma, as you know, it's a disease of the young individuals, an average age in the upper 20s, early 30s. And there's no treatment options exist for patients who relapse after autologous stem cell transplantation, with the exception of brentuximab vedotin, which remains the only drug approved by regulatory agencies, both the FDA and the EMA and other regulatory agencies. Nivolumab was recently approved on May 17 in the United States for the treatment of patients with relapsed Hodgkin lymphoma who failed both autologous transplant and brentuximab vedotin. And nivolumab is now the only second drug approved for this indication for relapsed Hodgkin lymphoma. So the trial, it's a phase 2 multi-arm, but the focus of this presentation, which is the arm that led to the approval of nivolumab in Hodgkin lymphoma, it's called Cohort B, which is really simple. You take patients who failed both autologous transplant and brentuximab vedotin at any time. Could be the first qualifying treatment post-autologous transplant. They could have other treatments before or after, but they must have had brentuximab vedotin after failing autologous transplant. Then the patient get enrolled on nivolumab, receiving 3 milligram per kilogram every 2 weeks until disease progression or prohibitive toxicity. And there is scheduled analysis by imaging studies, both by CT and PET scan, and also through independent review panel. This is the data. If you look at the overall response rate using independent review panel, it's 66%. It's 53 out of 80 patients. And by investigator assessment, it's 73%. You look at the breakdown of these responses, 9% complete responses and 58% partial responses. But if you look at the waterfall plot, it's more impressive because almost everyone had some benefits, some reduction in tumor measurements, even though some of them did not achieve a partial remission, but the majority of patients had some level of tumor reduction. And the study is still ongoing. The majority of patients still on treatment, so it's too early to call what is the exact progression-free survival, but at the time of the data cutoff, the median progression-free survival was 7.8 months, and the responses were very quick. You can see most responses occur within 2.1 months, which is usually at the first assessment. So the key points are shown here. PD-1 is a checkpoint inhibitor. Nivolumab is an important new treatment to address unmet need in patients with classical Hodgkin lymphoma with progressive disease and limited treatment options, especially after autologous transplant. And the patient who received nivolumab had a very good response, 66% by an independent panel, and a reasonable durable responses, but this is still ongoing. This may become even longer with time as we follow these patients for a longer period of time. Median duration of response, 7.8 months, and most patients had a response that was ongoing at the time of the analysis. Safety profile is nothing different from what's been seen in other solid tumors. Reasonably well tolerated, very rare grade 3 or 4 drug-related toxicities, and most adverse events were reversible, and there was no death related to the treatment on this study. And thank you.